my name's Neil Boudville. I'm the head of the Division of Internal Medicine at the medical school in UWA. And for today's video, we're going to do a panel discussion with some of the final year medical students who got the perfect score. So by perfect score, I mean that they failed none of the 12 stations. Of the about 80 students who managed to achieve this, we've randomly invited a few of them, and 3 of them are here. So thank you very much, Nick, Tatiana and Kate, and congratulations on becoming doctors. And we're going to be asking some questions, and I would like to thank Joe and Shaun from year 3. We'll be asking these newly minted doctors some questions about how to prepare for the OSCEs throughout the year and final year, and also what to do on the actual day of the OSCE. So let's go ahead.
Hi, thank you guys for doing this. Yeah, we'll just get straight into it. So can each of you describe what you guys did to prepare for the OSCE?
Yeah, so first of all, for this year, we were just talking beforehand and wanted to kind of say that our preparations for third year OSCEs and fourth year OSCEs were slightly different, so we can touch on both. Tat and I were in a study group with 2 other girls, and I actually joined their study group from last year after being on RCS. So do you want to talk about our study group and then our study group last year?
Yeah, so we have a study group of 4 people. I don't think the size of the study group is too important, but we were doing practice stations essentially from the start of the year. We'd meet up once a week, and we kind of had a go-to list of high yield presentations or topics or stations that have come up before or come up often that we were slowly working through. And we do 1 a week, and we often follow up. So if we did a station on pneumonia, for example, we'd prepare a short PowerPoint on pneumonia to go over afterwards. So we do, a station on shortness of breath, and then we do 4 stations. Each of us would prepare one. We write our own stations, and then afterwards we'd go through that high yield condition. So it'd be a kind of mix of an OSCE station and a condition, and then in the lead up to exams, probably a few months out, we started doing 2 stations, and then in probably a week before the OSCE, we ran a few full mock OSCE stations. So we did 12 stations and then book out some rooms in the library, and that was kind of good at simulating stress as much as we could. That was more this year. In third year, we did the same thing, but without probably the mock OSCEs at the end. That's a bit overkill, I think, for us last year. It wasn't a barrier, it was a bit less stress, but
yeah, so I did slightly different last year. I didn't prepare throughout the year, and I was down in Albany, which has 12 students, so only 7 of them were from UWA, so it's a little bit different. I probably only did a few practice stations in about the month leading up to it, and just really focused on things that came up in small group tutorials that the university provided. So things like the GP station and the ONG station often were pulled from those centralised teaching points, so I just focused on the things we've been taught in centralised teaching and the nature conditions with OSCE. And then this year, just to point out, I guess, with Tat and my study group, we had 4, which worked out that if we each brought 1 station, we then did 2 and marked 2. And so when you're thinking about the size, sometimes it helps to have, say, 4 or 6, because if you bring 1, you get to do 3. Whereas if you're in a pair, sometimes you're putting a lot more effort into writing them and less doing it. So the group size, it doesn't matter too much, but around that kind of size we found quite helpful.
Yeah, so mine was probably a little bit different. In third year, I was on RCS as well, so I was in Bunbury, and once again we had a few students around, so just sort of getting in groups with them, maybe 4 to 6 students, and splitting up in pairs and going off and doing stations. The stations we did were usually ones that we found online, didn't necessarily prepare them beforehand, or just ones that we come across through like the uni and other ways. And then also some of the junior doctors at the hospital ran a day where they went through some OSCEs with us, which was really helpful. As for this year, early in the year, I paired up with about 3 or 4 other students, and we, once a week, would go through some OSCEs. These were just ones we found online. We didn't really prepare them. We tried it a bit, but we found it sort of time-consuming. But it's really up to whatever strategy, I guess, you want to go for. We have some good online resources that we found, and just, went through them.
On those online resources, is there any that you recommend particularly that you found really good? Or?
Yeah, I don't know about. Some of them do cost money, so I don't know about plugging those ones, but I'm sure you can find them yourself. But ones that come to the top of my head are such as OSCE Stop, OSCE Bank, some of the, I know Griffith University also had some free online ones that you could access. And then I'm forgetting a lot of them, but there are a lot of online resources that have good marking keys, and some of them even they put the timer on the side and they show you like good marking keys and patient scripts.
I think one thing to touch on though as well, and it was kind of a reason that we started writing our own stations, is that I think a lot of the online resources focus a lot on checklist score. And there's a lot of kind of stress that comes with marking a friend and giving feedback when you miss this, you miss this, you miss this. And they're little things, and at the end of the day, it's about having a good structure and good rapport and, you know, getting used to the structure and being distressed and all the things that are not knowledge-based. I think the knowledge comes as the year progresses, and if you work hard enough, you know, you'll learn the knowledge that you need to know. The OSCE's not testing knowledge as much as it's testing kind of how much you can deal with that situation. So I would say take resources with a pinch of salt and don't stress about little scores here and there.
So along those lines, interesting that you say that. How do you know you're writing the station properly, right? Like how the faculty will write it.
Yeah.
And how do you know you're marking them like we will mark them?
Yeah, that's a good question.
I guess you don't. Yeah, that's the short answer. I don't think you know, but the alternative is I don't see.
Well, obviously you were.
There's lots of
what you were doing
resources.
is right though.
Mm.
Right, so.
Yeah.
There's lots of resources around. I think you get used to
Yeah.
kind of the structure of an OSCE marking key having sections, you know, a history section, a counselling section, and you can allocate points more or less.
I don't think we had that formally allocated points as well. So we'd have a topic and we'd say we think a history and an interpretation of this might be important for this station, and kind of we just did it.
Put it this way:
marking out
the actual OSCE, was it similar to the practice ones that you did?
Absolutely, yeah.
Okay.
Yeah.
And I think I was just going to sort of add on to Pat's point from before that the OSCEs that you might find online, they're very checklist based, and that's not really how the UWA OSCEs are all the time. They often are much more like holistic in their view of like you've got to interpret some imaging, and they always want you to sort of follow up the patient or consider the patient context. So if you're going to do the practice OSCEs online, I wouldn't be too worried if you miss some of the points on the checklist. It's more important that you're quite holistic in how you look at the patients.
On that note, is there anything looking back that you would change in the way you prepared, or any common mistakes students make when they're preparing for their OSCE?
I was going to say, I think sometimes you go into an OSCE and you think you have so much knowledge and you just want to get it all out there. And often those ones where you feel like you know the most about it, you might rush your way through it and you miss the key things. So I think a really important thing when you're preparing for OSCEs and when you're doing them is just really trying to stay focused and calm and go through it at a good pace, because I always found when marking them and doing them myself, the people who sometimes you get a station that you think you're going to hit it out of the park, but because you sped through it so quick because you want to show that you know it so well, you end up missing things.
I think one thing, I did it more this year, but maybe missed in third year a bit when OSCEs were fresh, because we didn't have a second year OSCE. Everyone's the same now, but we were the first cohort coming through that hadn't done an OSCE before coming to third year. And I think it was really beneficial this year to focus on learning a structure to stations. So learning, actually just dedicating, half a day or a day to having a structure for explaining a diagnosis, and then just kind of the checklist of how you go through explaining any diagnosis. It's a common station that can come up, or going through any form of management. There's just checklist things, these stations that recur, and you can get through with a structure that you've actually sat down with and learned a structure to any kind of question that can come up, even if the knowledge isn't 100% there.
So in terms of picking things to study, do you kind of try and cover a lot of broad topics to try and cover the whole course, or do you try and pick questions that you think they'll ask you?
I think it's a bit of both. So I know if you watched your first OSCE talk, I think it was, where you talk about the types of OSCEs they can give you. So thinking about, is it going to be a full comprehensive history station or a targeted history? Could they have an exam component? Could they get you to explain a diagnosis or an investigation? And you can start to think about what types of OSCEs or types of components there could be. And then within each of those, think about the common and the big things. So the major presented complaints, so making sure you have an approach to a headache, chest pain, shortness of breath, all the big ones for histories, but then also being able to talk through all of your exams, also being able to have an approach to explain your diagnosis or a test, or explaining a management plan both to a patient or to a senior. So you're still hitting all the common topics, but considering them in each different style of OSCE station or component.
I think that's something that UWA OSCEs do quite well, that I think people forget in their practice. I think we're also focused on taking a good history and going through the presentations and can I take a headache history and all of this stuff, but the UWA OSCEs are actually quite balanced in you'll get a couple history stations, but there's going to be a broad mix of explaining, counselling, practical skills, and history station is a part of that. But I wouldn't, I'd be wary of, that's probably for the last question as well, I'd be wary of practicing too many history stations and forgetting about the broad spectrum of things that can come up.
Yeah, I agree. A lot of the stations you'll practice with your friends are the history stations because they're the easy ones. They're the ones that have a very good differential diagnosis. You can ask questions about this. There's going to be a lot of different stations that aren't necessarily history, isn't their core component. So it's good to practice that sort of stuff as well.
And when comparing sort of the third and fourth year OSCE, what are some things you took away from third year that you focused on in fourth year?
I think it's very personal to how you went in the third year OSCE and what you found your strengths and weaknesses were. So I remember coming out of my third year OSCE, just feeling like I didn't structure my answers very well and didn't utilise the reading time as well either. I found I ended up just kind of copying down the trigger, which there's no point doing that because you have the trigger in the room. And so there were little things that I then personally tailored to fourth year. So in my reading time, I changed that. And instead of copying the trigger, I'd write down the points that I wanted to cover as a bit of a reference point. That was just a personal thing. And then I guess just working on the structure as well. So doing things like we spoke about, making sure you've got a good history structure, a good exam structure, a good way to explain things. That was probably the biggest change that I made. And then obviously there are different rotations or different types of stations you can get. So for us having rural GP and ED, there are certain things that you do slightly differently because it's that domain. Similar, I guess, for peds, there are certain different things that you always do in a peds station. So just having some new fields of medicine changes things too.
Yeah, I guess probably some of the main differences were in third year, I personally didn't really have too much of a structural approach to a lot of things, and I found in fourth year sort of just developing like a way to interpret x-rays, a way to go through ECGs, a way to approach like a counselling station, and just knowing that every time I read that trigger on the door, I could just walk straight in and I'd be able to go through that process. It makes the rest of the station really easy when you know that some part of the station's already taken care of. So yeah, I guess that was probably one of the big things I changed. Yeah, and then also the more you practice, especially giving yourself that 2-minute reading time and preparing time, you get more efficient at how you write the pre-going in trigger. So instead of just trying to write out every single question you want to ask, you might write just the differentials you're going to ask about, and then you know that you can, in the station, you look at that differential and you say, oh, I know what the 3 questions I want to ask about that are, and then you list those instead. So just being more efficient.
I don't have much more to add. I think in third year though, because I did do a lot of preparation, I think, or probably more preparation than was necessary maybe in third year, but I think I was kind of, I had high hopes for myself, but it was it was still a new experience. And I think I surprised myself with how stressful the situation was for me, still being well practiced. So I think something I took into fourth year was trying to simulate that stress as much as I could, because it is a very high stress day no matter how much you're doing. It's, it's an OSCE. So I think the more you can do to simulate pressure, because I'm not great under pressure and stress, and that was one of the things I wanted to work on. Just taking away your own personal feedback, I think is.
Yeah. And I think working on that pressure situation, and we want to touch on that at some point as well, is really important as well. So being able to, I told my second and third years in PAL and things like that, but the most important thing for me in the station is having a really strong opening, because I found that in itself settled my nerves. If I could almost kind of simulate or think through it in my head in the weeks leading up, that knock on the door, feeling the pressure, walking in and being able to say, hi, my name's Kate, I'm the GP in practice today, and just having a really smooth one-liner as you sit down and introduce yourself to the patient is really important. And then once the station's going, I think the nerves start to go. So that was really key for me in terms of managing the pressure. And then also knowing that you don't have to do every station perfectly and you can fail a couple of stations, and being able to shut the door and leave that station behind and move on to the next one is also really important. and doing things like practicing runs of OSCEs. So the one smoke OSCE or within your own study group, and feeling like a station doesn't go very well and then able to go straight to the next one and forget about it is a really good thing to practice as well. I don't know if you guys have anything to add to the pressure.
Yeah, pretty much what you said. I think the practicing the runs and OSCEs is a good way to practice the pressure and just sort of getting over any mistakes that you think you might have made because they're in the past, you can't change them. It's now on to the next one.
So I know this year we have a leaps station. I don't know if you guys have anything like that. How do you prepare for a station like that? That's not, a textbook.
Yeah, Leaps is the most unpredictable station in my opinion. You never know what it's going to be, and it can be a number of things. But I think Leaps in general. I mean, can I speak to our specific stations?
Yeah, sure.
So we had donning and doffing this year. And I did not know how to don or doff, and I can guarantee you I did not get the steps correct. But it's about being professional, and it's about having a conversation with someone, or educating someone, or it's all of those titles. They truly are assessing those titles in those stations. And I think if you can go in and you can have a personable conversation and be professional and refer to guidelines and be safe and just think through all the things that they'd want you to do on the wards, I think you're going to be 80% of the way there in the leap station. It's not one that's assessing your knowledge. It's about having a good conversation. And
I can tell you hardly anyone failed.
yeah, see? And we all walked out being
Right.
like, oh. But that's moving on to the next station again.
Yeah, like you discussed.
I guess also there are the online modules on the LMS for leaps as well. There's a lot of resources available. So if you do want to study something, those are worthwhile. Of course, you don't know what's going to be in there, but there is a high chance that that stuff at least is relevant.
And that covers things like clinical handovers and I think aggression, violence in the workplace and donning and doffing, and these things have come up. We also had a handover in our ski station. So again, kind of what I was saying in the first question, it is good to make sure you've covered all those online resources because it's something that's gone to the whole cohort.
Sort of going back to dealing with the stress of it all, is there anything that you would recommend doing on the day or the day before and not doing on the day just to sort of keep yourself calm?
I think personally having a good routine. So before every exam, I like to try and exercise and have like a coffee on the way, and then make a playlist, a relaxing playlist or a pump up playlist, or you've got to find what works for you. And I think doing things like the wands and faculty practice OSCEs, you work out what works and what doesn't work for you. But just kind of have your routine that you do and stick to that.
Yeah.
Yeah, I feel like I was more nervous before the MD3 OSCE just because it was new, and I think by now we all know our sort of techniques or things that make us calm. So just finding what works for you and just taking some time in the morning, like before the OSCE. You're not going to learn anything new before the OSCE that's going to change the result, but what you can do is really focus yourself and calm yourself, just setting yourself up to do really well later in the day.
I think everyone does it a bit differently, and same thing the night before. I always think that it's not the night before that counts, it's the night before that, because you can kind of get away with a day of, being a bit worried and not getting as much sleep. I'm personally a good sleeper, but I think people can then worry that they're not getting enough sleep before the OSCE and then get stressed about that. And I think, just try and work out what works for you. And if you don't sleep as much the night before, then just trust that the adrenaline will get you through on the day once you're in there.
I think also, preparation is helpful as well. I think going in knowing that you've done all you can, reassuring yourself, and then also if little things are, we didn't do this personally, but I know other people got, friends who were junior doctors or even people who weren't really friends to do a few practices with them, people that you're not comfortable with to mark some practice stations with you. And then you've been in that kind of stressful situation, not practicing with friends all the time when you can giggle and move past it and not be too embarrassed, but simulating that marker in the room situation can always help as well.
Shaun asked this question, but you were very kind in not quite answering it. But you've got a big cohort. Were there anything that other students that did that you would not advise people to do? Were there any bad things done?
I guess you're sort of looking out at someone else, and I personally, I would say like, oh, don't stay up all night the night before studying because I don't think you're going to learn too much. But for some people, that might work for them. It's hard for me to say because I don't know how they did. But yeah, I think just thinking that you've got a lot to do before you go in, day or two before, it's not true. You've done it throughout the last 3 years of your course. You've already done a lot of the learning, and you could go into an OSCE the next day, and all the stuff you've learned in the past is going to carry through. So just have confidence in that you're not going in blind. You've actually been preparing for the last 3 years.
Yeah, I think also from we just marked the third year mock OSCE, and I think I had a few students come through who you could tell knew so much. They just knew all the knowledge. It was all there for the station, but the communication skills were just not there. And they're the stations that are really sad to mark because I know that they've done so much book work. But the OSCE, I think I really went in with the attitude this year that the OSCE wasn't assessing book work as much. You know, as Lansky said, it's by the end of fourth year, by osmosis, it's enough is there usually for knowledge to be there. I don't know if I can speak to that for everyone, but I just feel like it's more assessing communication skills and not focusing too much on book knowledge. I think it's
a common question the faculty talk about with each other is, do some students get away with just doing practice OSCEs and nothing else, or do they, like you have the PowerPoint presentation and you learn around the topic? Do some students just do OSCEs? Is that a way to pass?
I don't know what people do.
Yeah, I think a lot of the study you do that is an OSCE study will come through, like learning your core conditions and your differentials is obviously going to be assessed in a history or examination station. But as to the point, could you just do practice OSCEs? I don't think it helps your clinical knowledge too much doing the practice OSCEs. You're not really going to learn something new by doing those, but what you can try focus on is your communication skills and how you sort of act under situations where you don't necessarily know the answer. So you think of a different way, like how can I be safe in this station, and how can I make sure I'm covering all the points that are probably going to be important here.
I guess like in terms of these students that know a lot, it might be hard for you guys to answer this, but the communication is the hard part. For those kind of stations where you have to explain diagnoses or you have to counsel, would you recommend maybe putting together some little short spiels that you can kind of rattle off if you know a station's coming up, or do you recommend kind of just knowing topics so that you can kind of do it off the top of your head? If you know what I mean?
I think it's a bit of both again. So I think knowing your common topics and practicing, and this comes up in prac and placement as well as in study groups. But even if you're just talking about conditions, like talking about pneumonia or talking about how you counsel someone on a certain result that they have, or seeing GPs tell patients that they've got diabetes and this is why we need to monitor their kidney function. And so just having conversations among people helps with explaining things. Or explaining it to each other is a good test of your knowledge. In terms of having little spiels, do you kind of mean structures on how to approach it, or?
Yeah, like there's maybe for the PEDS ones when you're explaining to a parent, you kind of maybe prepare a little patient-friendly language introduction or something that you can kind of use.
I didn't do that personally. I think buzzwords do have a role in some situations. I remember we always were hoping that prostate cancer would come up in the meditative, and we always wanted to say it was prostate specific and not cancer specific. Little things. There are just little buzzwords and shared decision making. I always liked to say, like, we can talk about the options and come to a decision together. I think buzzwords have their role, but I didn't memorise any spiels per se, but I would kind of memorise headings in approaching explaining a diagnosis, for example. But that's just me.
I think, you do have to take into account that you're talking to someone who's not necessarily medical, so just watching your language. As for having a plan, I think it's just, if you know, just make sure whenever you study like your core conditions, you're thinking like, well, what is this condition? Like at the base of it, like, is this a problem with the heart, not being able to pump hard enough or something? And just using that simple language to the patient. As for a process to go through, I think one that's quite simple is ask, tell, ask. So ask the patient, have you ever heard of heart failure before? The patient will say yes or no, and then you can tell them some information about it quite simply in maybe 1 or 2 sentences. And then finally you can ask them, so do you have any questions about that, or do you understand what I've said?
Yeah, I think everyone will find a different way of explaining certain things. So I know when I explain diagnosis, sometimes you need to ask them a few questions, and then you'd ask what their understanding was, and then I often explained what was normal and then what the problem was with their kidneys or their heart or something, and then kind of came back and asked if they had any more questions. So you can look a few of these things up online. Like Geeky Medics often has videos about how to explain a diagnosis or explain a test, and they're quite good.
Pretty good too,
yeah, they're quite good to give you some kind of structures on how to approach different types of questions.
Often when you read the trigger, there's a list of tasks to go through. How do you usually allocate your time to each of them?
Luckily, often the triggers do have a time allocation in some way. They're like, don't spend more than 4 minutes on this, or like, they not always, but often, like, if they do have that, that's an instant way of knowing sort of what to spend it on. I think, just it is practice is really the answer to that. You're going to get to know, like, if I'm asking a big history, like, it's going to take me quite a few minutes. So the next few might just be 1 or 2 minutes for each of them. But I'd say at a minimum, you should be saving at bare minimum a minute for each of the points. If you get to the history and it's taking you 6 minutes and there's 3 more things after that, you probably should move on.
Yeah, and I think likewise the 2-minute whistle at the end is a good guide. If you're kind of stuck on a point and the whistle goes, it's like time to hurry up and get those points, because the marginal difference you're going to get by hopping on about the point that you're still on, probably not the same as touching on those next sections of your history. Of your checklist score. I think it does come with practice again, sadly. I think you get better at kind of going through a history a bit quicker and knowing how long a history should take, and you practice a few stations where you run out of time and you realise, okay, I need to be quicker at this, or my consenting someone is taking too long. I remember the day before the OSCE we went through consents and stuff, and my consents were taking too long and we were trying to get them down, and because we knew we weren't going to have a full station to consent someone. It just comes with practice.
Yeah, it's very trigger dependent. I think we've spoken mainly about once we have a history and then you interpret something, you've got a few questions, in which case the history is generally the longest bit. But just read the points, and if it's kind of interpret a chest x-ray and do a respiratory exam, then you should be interpreting the chest x-ray in 2 minutes and then spending longer on the rest of the exam. So just kind of having a look and judging yourself how quickly you think you need to be moving on. But it's mainly practice.
As you know, most students though fail on the global score. Did you have a strategy for the global score? Was there a strategy?
I think always say thank you at the end of your stage. The whistle's already gone, so you're not going to be earning any more points for. But you do leave an impression on them. So the last thing they mark is the global score, and if you were smiling and said thank you at the end of the station to both the examiner and the patient, I like to think that probably helps a little bit. And going in quite confident, knowing the patient's name. First thing I do when I see a trigger is write down the patient's name and age and who I am. So say, hey, I'm Nick, I'm the intern. Nice to meet you, Mrs. Smith.
That's exactly the same as what I do. So yeah, and if you're stressed by the trigger, it's a nice way to start as well. Even looking at the trigger is, you are the GP in Karratha. Like, write down GP Karratha, so they're there, and then starting strong. Hi, I am the GP. Not hi, I'm the. Oh God, let me look at the trigger. And you've lost your global score in 2 seconds walking in the room. And I learned that as well, marking the third years. I learned a lot from reading the marker the first time, but the students who did the best were the ones who were confident and walked in, and you could just tell that they were going to have a nice, open, friendly conversation with you. A smile goes a long way.
Yeah, definitely. Walk in, introduce yourself, look the patient in the eye, or acknowledge the examiner, look the patient in the eye, introduce yourself, know their name. This is really important. After that, having a little bit of structure, kind of following the order of the trigger, being able to kind of signpost and say, I'm going to move on and examine you now. Shows that you've got the structure, shows that you're safe, and then thanking them at the end. So just kind of think of the first bit is really key, having a bit of structure, and then closing really nicely. And I think the global score, and then just being safe.
Little things as well, like if it's a surgery station and the trigger says they're in pain, walking in and saying, do you need any pain relief before we start this conversation? It's showing that you're thinking about the situation of that patient. I think, that's
And just other that we mentioned, keeping eye contact. One of my pet peeves is don't go in there and write while you're in there. Stay engaged with the patient. You're not going to read whatever you've written, so there's no point writing when you go into a station, I feel. So going in, just making sure that you're giving all your attention to the patient. You can acknowledge the examiner in the corner, but you shouldn't really be looking at them for the rest of the time. You can just focus on the patient. That's the reason you're there.
Fantastic. I mean, so many pearls of wisdom in that short interview. Any final comments you want to make?
I don't think so. I think just once you've still got sticking from now until your exam this year and next year again, you've still got a few weeks, which is heaps and heaps of time to do some practices and start to kind of get a feel for the structure of the OSCE. And then once you're on the day, just going through your normal routine, trying to stay calm, have a good entry, and then being able to leave stations behind. I think it's kind of the stress management that I found most important. But plenty of time to
Yeah, plenty of time. I think going in next year with a plan is nice, but I think, as Kate said, there's plenty of time before your exams. I think similar to what Lansky said before, trusting your knowledge, trusting that it's built over years, and just having a good rapport with the patient, and trying to be as professional and confident, and focusing on all the other things that you think kind of won't fall into place. But
yeah, and I guess some high yield stuff before walking in would just be getting with some friends and practicing just a few stations with them, trying to do a few in a row so you simulate that's moving on to one after another. And then lastly, just practicing approaches to common things like interpreting x-rays, interpreting ECGs, counselling a patient, going through like specific types of histories like a heads assessment, doing that sort of stuff, and just knowing that when you get there on the day, you don't have to think about it, it's already second nature.
yeah, on that, centralised teaching, I would spend, if you're running out of time, centralised teaching is important,
And I think the thing is as well, the big things are important to be across because it looks worse if you don't know the common conditions. If it's something a bit rarer, you can kind of get away with just being safe and wanting to exclude the nasty things. So focus on the main presentations, the main conditions, centralised teaching.
Oh, can I go backwards quickly?
Please,
Sorry. Just one thing I was going to say on what to do when you get to the trigger. I remember I did it last year, a bit more than this year, but I always wrote down what's going to make me fail this station. So when I was unsure, like we had a PEDS shortness of breath, it's a sick child, what's going to make me fail this station? Not admitting them, and that was always my, how do I not fail this station when I was stressing? I think that's a really nice thing. So who are you on the trigger and what is going to make me fail this station, and make sure that you say this. That's what I want to say.
Fantastic. Well, thanks, Kate, Tatiana, and Nick. Really appreciate it.
Cheers.
And best of luck in your future career.
Thank you.
Thank you.
Okay.